Thank you, delegates. Just like to resume standing orders. I've just advised the President or reminded him about not using the telephone whilst in the meeting. We come to one of the more pleasant parts of the meeting, and I'll invite the President to the lectern.
Ladies and gentlemen, indeed it is one of the more pleasant parts of the National Conference to the session on the role of fellows. Now we come, delegates, special guests, ladies and gentlemen, to a special part of the proceedings where we get a chance to formally recognise the outstanding contribution made by several of our colleagues. The AMA is one of the most respected and influential voices in medicine and healthcare. When the AMA talks, people listen, and we take that responsibility very heavily. This is due in no small part to the integrity, knowledge and judgment of leading AMA members that they've displayed when they're contributing to policy discussions and debates. Whether it be on vaccination, hospital funding, drinking, gambling, Indigenous care, care for children or in the elderly, or the dangers of fad diets or Google diagnoses, the AMA is turned to as a voice of reason. Each of the people being admitted to the role of fellows today exemplify all that makes the AMA such a trusted and well-regarded contributor to national health policy and debates. And it's wonderful that we have the opportunity today to show our appreciation for the outstanding contribution each one has made. Now, are we bringing them forward, or am I reading out their citations straight away? I think I might call the doctors to come forward when I mention their name. Dr. Richard Kidd, would you like to come forward? Thank you. I'll probably get you in the middle here just for the moment. Dr. Richard Kidd has vast clinical experience gained through working as a highly regarded GP for the past 30 years and has been equally devoted in his service to the profession. Dr. Kidd has served the AMA in numerous capacities both in Queensland and at the national level, including AMA Queensland President-elect 2010-11, President 2011-12, as well as the current chair of the AMA Queensland Council of General Practice. He also represents AMA Queensland on federal AMA committees, including Healthy Ageing, Economics and Workforce, and the Indigenous Task Force. He's worked tirelessly to make sure the interests of patients and the views of the medical profession are heard by government. Thank you very much. Associate Professor David Mountain is an energetic and dedicated practitioner. An energetic and dedicated practitioner who has unflinchingly given of his time to serve the AMA membership and advance the interests of patients while simultaneously working at the forefront of emergency medicine for almost 2 decades. Associate Professor Mountain is head of the Department of Emergency Medicine at Perth's Sir Giles Gardner Hospital and Associate Professor in Emergency Medicine at the University of Western Australia. He joined the AMA WA Council in 2000 and has served in a number of senior AMA positions, both state and national. He was AMA WA President between 2010-2012 and a member of Federal AMA Council, has represented Emergency Medicine Craft Group and served on a number of important committees, including Public Health and Child and Youth Health, Economics and Workforce and Aged Care. Thank you very much. Now, the third recipient is Professor Simon Wilcock, who is a GP. Has combined a lifelong commitment to his patients with a keen interest in medical training and the health and well-being of his colleagues. His dedication to his patients is evident in his unstinting provision of after-hours care and the expertise he's developed in musculoskeletal medicine. But Professor Wilcock has simultaneously worked to advance medical training and improve the working conditions of practitioners. He's the discipline head of General Practice at the University of Sydney, Associate Dean for Postgraduate Medical Education and Training in the Sydney Medical Program, and for 6 years he's been the Chair of the General Practice of GP Education. And please join me with congratulating Simon Wilcock. We're going to go back to front. Now we're going to keep you guys up here just for a moment. Please once again join me in congratulating Dr. Kidd, Associate Professor Mountain and Professor Wilcock in their admission to the AMA Roll of Fellows. Now Dr. Kidd would like to say a few words on behalf of the new Fellows. Dr. Kidd.
I'll keep it brief, but I've been asked to just say a few words on behalf of my fellow recipients. So first of all, thank you. It's truly a great honour. I do feel that we are, however, standing here really representative of many other wonderful and meritorious people. I found myself asking myself, fellowship, well, what does that really mean here today? And I thought of the colleges, and there it's about clinical standards, getting over a particular line. But for the AMA, I think it's much more about advocacy, leadership, mentorship and more. And when I thought about more, I thought about the fellowship of the ring, bonds of friendship and trust and respect in the face of adversity, sustaining and supporting each other to do good. And for me, that desire to do good started early in childhood. I read a book about Albert Schweitzer at the age of 7 and the amazing work he did as a medical missionary in Equatorial Africa. And basically he inspired me to become a doctor, and that was coming from a family where no one had been to university. And I, through that inspiration, followed the same sort of route that a lot of young doctors do, and went and worked as a volunteer in Papua New Guinea for a couple of years. And through that I came to see the value of having a medical community that was supportive of me. And this morning we heard from Professor Bashir about Australian doctors doing good in Mongolia. And this global humanitarian aspect of the AMA I think is really crucial and important. And one of the things that I've been very proud about, Steve said a lot of wonderful things about what the AMA has been doing in the last 12 months, but I was really, really pleased with the work that we've done in advocating for the asylum seekers and for the Indigenous people in Australia. And in that regard, as AMA Queensland President, I was truly honoured to be able to go up to the Thursday Island of the Torres Strait and really see for myself the practical implications for health for our Indigenous people, where a measly little piece of cauliflower costs $7, and yet the fast food, junk food, costs the same as it did in Brisbane. So to actually try and eat healthily in the Torres Strait is a major challenge, and it's just so much easier to eat the junk food. And things like this we have to address. And that's one of the things that I've found has been really great about being part of the AMA. It's part of being a team where a lot of other people do a lot of good work. It makes you look good, but what's really important is it allows you to do good. And that's been, for me, a great privilege. And I think Khalil Gibran summed that up by saying that work is love made visible. And I think most people who have ended up with this fellowship of the AMA have been people who have been doing really good work, and it's the AMA that's allowed us to. So on that note, thank you very much.
Thank you very much. And as Dr. Kidd, Associate Professor Mountain and Professor Wilcock rejoins their seats, we'll just give them another round of applause. Thank you very much.
Thank you, President, and my own congratulations once again to the new fellows. We move to more of the staid part of the meeting, and you will be aware that we've completed most of the work. I'm pleased to advise that there are no further notices of urgency motion, and National Conference has already disposed of the consideration of the one notice. I'll have advised Drs Milford and Parnas, responsible for the motion, that it will be discussed at 11 o'clock 25 May 2013, which is tomorrow. Hard copies of the draft urgency motion will be tabled tomorrow morning. I also wish to advise you that I've extended an invitation to Julian Raitt of MDA National to address us briefly at around the same time, so just prior to 11 a.m. As a consequence of there not being a great deal of other work and the scheduled time of the AGM is 4:45, I thought I'd just take the opportunity to let some of the delegates express some of their views. It's early days on this meeting, but we've tried new technology. Several people have spoken to me and have expressed a view, so it's a little bit like a soapbox session. It can be any topic. It can be formulated as a question. Say we can have a maximum of 7 people. There's no microphones around the room, so I'll invite people, if they'd like to say something, to come up to the stairs here and come to the lectern. I see Dr Massage, Dr Rosenberg, pass, Dr Bout. This isn't the AGM. 2 minutes.
Thank you, Roderick. Thank you for the opportunity to address the people up here and also the audience. Personally, even though it's only the first day of this conference, I've found it very frustrating. And it's actually been a problem with the fact that it feels like we've been spoon-fed and corralled and muzzled. And what surprises me, having been the executive director of a division of
and not just coming to listen to the pre-full brainful. Thank you very much.